So I want to talk to you today about pediatric fractures, or fractures in children, when children break their bones and dislocate their joints. Now, importantly, this topic is really important for mom and dad because mostly I find myself managing the expectations and getting understanding of what we're going to do. So say for example, one of the most common fractures that we deal with is wrist fracture, where a child falls on their hand and wrist and may or may not have a deformity. In other words, the wrist, it may look crooked, may not. So ultimately, what are the considerations that we have for this? And one of them is that children are still growing. And in many cases, the bone doesn't actually physically break. It kind of bends like a green stick. So sometimes the arm can be completely bent and it's actually not separated. It's not fractured off, but it's bent. And so we really have to just kind of straighten it out. Sometimes it's a little bit worse than that, and we require surgery for that, where we have to set the bones in place and put a pin in place. So you have to understand there's differences in these injuries. Some of them, and many of them, can be treated in just a cast. Many of them require surgery, and understand that there's variability depending on the joint and what exactly happened. So the goal in the office is for me to show you the x-rays, to give you some understanding on exactly the factors that will help this heal the best. And understand that if we're doing surgery, a lot of times that surgery may not involve an incision. It may be a closed reduction where we set the bone in place. It may include a pinning where we put a pin to hold it in place. And then that may require a second procedure down the road where we have to take the pin out. Most of the time we take the pin out in the office. Sometimes children don't tolerate it. The biggest thing to consider about pediatric fractures is that these fractures heal well, and the healing capacity of children is enormous, and it really outshines that of any adult. So we can line up the bones pretty close, and in a month's time or several months it's going to be perfectly straight because they're growing. So consider this when we're showing you the x-rays and explaining the problem to you.